Welcome back to Jersey Matters. Patient-focused healthcare is coming to New Jersey. Now, if you think to yourself, well, wait a second, I thought we always had patient-focused healthcare. Here's a man that can explain the difference. Matt Weissert is the Senior Vice President of Operations at Paladina Health. Thank you so much for being here.
Thanks for having me.
Explain the difference. Why haven't we had patient-focused healthcare in the past?
Yeah, well, I think you have in certain places. I think the difference at Paladina Health, what we do, it's called direct primary care. And so normally when you go to your family physician, you would go in there, you would have a copay, you might wait in the waiting room, and then you would go see your physician, spend time with them. You might spend 10 minutes with them, you might spend 15, who knows. But with us, there's actually no copay. You have same day, next day appointments, little to no wait time, and then you have 24/7 access to your physician as well. Also, you have a minimum of 30 minutes with your patient or with our physician. If you're coming in for a physical or maybe your first time, you might have 60 to 90 minutes. What we're trying to do is get that interaction to be with the patient and the physician so that they can, take care of them.
Yeah, do I have to pay more for this?
No, you don't. It's actually, the unique thing about this is in the direct primary care model, it's actually a benefit that you receive for you and your family. So it's paid for by your employer, or in this case, the state and the unions got together to form this program so that if you're a state worker or a school teacher or a family member of that, you receive this for free at no cost to you.
Well, I can already sense what people were thinking. Does that mean as a taxpayer they have to pay more for this?
No, not at all, not at all. So right now, if you're a state worker, you're a school employee or a school teacher, you're paying into the system, and then you receive your benefits. This is just a benefit that you can choose at no cost to you.
So I have to be a state worker to get this?
Either a state worker or a school employee or a family member of it for now, and that's part of the
You say
program.
For now, what does that mean?
There could be other employers. So we're in 10 states across the country, and we work with employers. So there could be employers here in the state that may want to be a part of this as well. And if you wanted to be a part of this, you want to have this great service, go to your employer and say, is this something that we could do?
What is Paladina Health exactly? Are you a healthcare provider? Are you an insurance company? What?
No, we're not. So when we talk about your family physician, that's what we do. We do primary care. We're in 10 states. We have about 50 offices across the country. And like I said before, the state and the unions got together and they decided that they wanted to bring great healthcare, great service to their employers. And they said, what's out there? What's different? What's innovative? And we were one of 2 companies that were chosen to do this across the state.
See, there's something that to me is not adding up, and
Sure.
Maybe you can work
Sure.
this out for me. So it sounds great. It does sound great.
Yep.
You're making it sound great, but not all these companies are jumping on this. And I would imagine it's because of cost. And so correct me if I'm wrong, but the states can do it because they have access to taxpayers' money, they have access to pension fund money, they have access to the state employees, and so they can afford it where most of us can't. Is there any truth to that at all?
I would say no. I would say the difference is in the normal system which we're in right now, it's a fee for service. So a doctor they're usually paid upon how much volume I see. So if I see a lot of patients, I'm going to get paid, and then I send them off to a specialist, and that specialist, then they bill, and then that bill comes back in. With us, what we're doing is we're taking 80 to 90% of all healthcare needs can be done in a primary care setting. So what we're saying is let's take care of as many people as we can in that setting, which is going to save costs over time. So you come in, let's say you come in for an earache or something with your knee, we can do all of that right there rather than saying, we're going to take care of this right now, and we're going to send you a bill and then come back or see a specialist later.
Oh, so what you're saying is when you eliminate somebody getting people in and out quickly and saying you have to come back or sending you out to a specialist, you reduce costs that much that you can afford to give this health care?
Absolutely.
And is that played out?
It is in several places, absolutely. And to go back to your point about the state can be the one that affords, we actually only do this in 2 states. All of our other clients are actually businesses that are doing this because they've seen skyrocketing healthcare costs that they're just being passed along to their employees. And what they're saying is there a better way to do this. And we believe that it's direct primary care. We focus on having great quality outcomes with our patients, really great service, and like I said, no wait times, same day, next day service, 24/7 access to your physician via phone, and then also lowering that cost. You have no out of pocket expense to you, when you go in for a copay or anything like that. And then over time, you're going to be healthier, and it's going to save costs to the system.
And the insurance companies are okay with this? So you can have insurance through Blue Cross Blue Shield?
Absolutely.
And that covers this?
Yeah, so when you have your Blue Cross Blue Shield or any insurance for that matter, you have you can go to a primary care physician, but normally you would pay a copay. And then all of your other things are taken care of just as you would.
Who absorbs the copay? If the insurance companies don't, the insurance companies would normally be a part of this, right?
Right.
You just say no to them?
No, what we're doing is we're receiving a monthly fee from the employer, and then we take care of that. We don't bill the insured. We don't do any of the insurance claims. We don't bill anything. We don't go from them because we're doing everything for that monthly fee.
So the employer has to pay more?
Absolutely.
So
not paying more. The employee is already paying for the primary care, whether that be with us or with a primary care physician in the normal system. With us, it's already taken care of.
And how long have you been doing this?
So we started in 2013.
And you just moved into the state. Where are you in the state now?
So we're in Hamilton and also in Clifton. So we're in 2 sites now. We're hoping to expand across the
And when you talk about expansion, can you share that with us? Where else you might be going?
So right now we're looking at the populations everywhere across the state. Those are the 2 most populated for the people that we want to take care of right now, which is the unions, mainly the state workers that are in the Trenton area, and then also there's a large population that also around the Newark, Clifton area.
And if an employer is interested, where do they go to find out more information?
PaladinaHealth.com is where they could get any information they would need on this.
Wonderful. Thank you.
Thank you. I appreciate it.
Thank you.
Thank you.
Matthew Weissert is the Senior Vice President of Operations at Paladina Health. When Jersey Matters continues, it was a sight to see. The Battle of Trenton reenacted in the snow. Dawn takes us there when Jersey Matters continues.